Welcome everyone. I'm very happy to see many of you here for our CLUE seminar. So CLUE is a training program called Collaborative Learning of Usability Experiences. It's run out of Carleton University. And part of this program allows me to invite really great speakers to come and talk about their research and industry experience. And so I'm delighted to welcome Celine Latulipe today. She's an associate professor of computer science at the University of Manitoba, and she's going to talk about studying older adults and technology today. So welcome, Celine.
Thank you so much, Audrey. I really appreciate the invitation. I'm very excited to be here and talk to you all today. So as Audrey said, I'm going to be talking to you about older adults, but I'm going to be talking to you also about close others, the people around older adults who help them. And I see this as a technology blind spot at the moment. So as Audrey said, I'm an associate professor at Manitoba. I am an Ontario girl, actually. I grew up outside of Toronto and did my degrees at Waterloo. But then I lived in the United States in North Carolina for about 14 years. And only recently in 2019 did I come back to Canada to join the University of Manitoba. And I'm pretty happy to be home. So today I'm going to talk to you. First, I'm going to give you some definitions that you need to understand what I'm talking about. And then I'm going to talk about these patient portal studies that I did with Wake Forest Medical School in North Carolina while I was a professor down in the US, 3 different studies. And then I'm going to give you just a little sneak preview about the Canadian banking scene and how that relates to some of these issues that I want to share with you. And I'm going to end by talking to you about some proxy access design considerations. And I'll tell you what that means, but sort of 2 different ways of looking at how we might design technology better to support the people who actually support the older adults in our society. So let's get started. So the first thing I want to define for you is the idea of e-services. And many of you have used lots of different e-services. So if you're doing online banking, that's an e-service. If you're using any kind of government website where you log in and do things, that's an e-service. Maybe you log in and manage your cell phone usage and data. That's an e-service. So it's basically any website where you log in and you have to provide a password and an ID, and then your data is stored there. You get access to it, and there's functionality that you can use to do various things. So lots of these things originated not as e-services, but as services that we used going out to stores and buildings, government facilities, etc. And now many of them have moved online. And in fact, lots of the brick and mortar versions of these institutions are sort of closing shop. And really, you're more and more forced to do these types of things online. So this can be good. There's some positives here. If you live in a rural area far from a city, it may be hard for you to access these types of services. So being able to get to them online could be good. If you have mobility issues, as many older adults do, then that could also be a way to help older adults access these services. And of course, in the Canadian climate, icy streets, you may not want to go out there and navigate to get to one of these locations. And then, of course, in our current COVID situation, if you are trying to avoid infection, trying to avoid going out to places can be really beneficial. And that, of course, is important for our older adult population who are more at risk to severe versions of the virus should they acquire it. But there are some issues. E-services require that you have a bunch of things. So you've definitely got to have some decent internet access. You need to have a computer or a laptop or a smartphone or tablet or something. You need to have an email address. Almost every e-service requires that you register and then a confirmation is sent to your email. So if you're not doing email, if you're not that kind of person, you don't have an email address, this is an access barrier. There's also just in general a certain level of tech savviness that is really necessary to be able to smoothly use these types of services. Once you've used a bunch of them, they all seem very easy, but when you're not used to them, it's not quite so easy. And finally, there's also the issue of simply being able to remember all the different usernames and passwords that are set up for each system. So one of the other things that I want to define for you is the term close others. And you'll often hear people talk about the term caregivers, people who serve as caregivers. And I prefer the term close others for 2 reasons. First of all, caregiver tends to sort of focus on the healthcare aspects. And we know that people help older adults, support older adults with all sorts of different things, not just medical care. So close others is sort of more of a broad term. And I think close others, which is a term that came from occupational therapy, also has the benefit of suggesting more of a a bi-directional kind of relationship, whereas caregiver suggests there's a person who's providing care and that care is directed in one way to the older adult. And close others seems to suggest more of a bi-directional relationship. So close others, these people surrounding older adults, what we know is that they often actually sort of help older adults use e-services. And we want to look into that. What does that mean? How does it work? And are there any issues around this? So close others could be all sorts of different people. And I think we tend to think that there's a caregiver and an older adult, and it's a one-on-one relationship. And actually, we think there's a multitude of people surrounding an older adult who may be providing different types of support. Some of them may be family members, some of them may be neighbors or friends or community members, some of them may be paid support people, and they may help with various different things, such as banking or with healthcare or with grocery shopping or what have you. And so this is a complex ecosystem, and it changes over time. So it's not just this static, easy, this is the person and there's their caregiver and that's that. So in the Canadian context, we have more than 6.5 million older adults, as defined as 65 plus. We've got more than 8 million people who serve in informal caregiver or close other roles. And if you look at older adults who are living in the community, for the caregiving and help that's provided to them, 80% of that is provided by informal caregivers, as in not paid people, but just the people who are helping out of the goodness of their hearts. So that's a lot of help being provided. And we're of course interested in when is that help being provided with respect to technology. So I'd like to sort of pause for a second and ask you, have you ever helped an older adult use some kind of e-service? So whether it's banking or shopping or email or accessing utilities and changing utilities or healthcare or government, type something in the chat about the service that you use that you help the older adult with. So what type of service are you helping an older adult with? So I'm seeing some yeses, but is it banking or is it shopping? What are you helping people with? Online banking, COVID testing, shopping, renewal of license, banking and shopping, e-bill payment. So yes, I think what we're seeing is yes, there's a lot of people helping older adults with e-services. So thanks, that's fantastic. Yes, this happens a fair amount. Excellent. All of the above. Okay, right. Administrative things, banking, you name it. Okay. So the last thing I wanted to find before we really jump in is this idea of what we call proxy accounts. So a proxy account is when an e-service provides an account that's sort of a separate access to an account holder for a second person. So as an example, say I had an elderly mother, she has a bank account, and that bank gave me a proxy account that would allow me to log in and get access to my mother's bank account and act on her behalf. Okay, so that would be a proxy account. And the most critical thing about a proxy account is that the proxy account holder has separate login credentials. So if I had a proxy account, that would mean that my elderly mother does not have to share her password with me. I'd have my own, right? And the other aspect of proxy accounts to think about is that they often will allow limited access to information and functionality. So if I had a proxy bank account for my elderly mother, maybe it only allows me to see the checkings account, not all of the savings, and maybe I'm only able to do bill payments and I'm not able to transfer money out to any external accounts, right? That would be sort of an example of the type of limits that could be imposed on a proxy account. So now that I've sort of defined these different things, close others and e-services and proxy accounts, let's jump into some of the research that I did. When I was in North Carolina, I worked with colleagues at Wake Forest Medical Center, and we were looking at something called patient portals, and I'll tell you what that's all about. And so we were investigating older adults' usage of patient portals. So here's what a patient portal is. This is a healthy service. It's very, very common in the US. You log in, so the patient portal is offered by a hospital or a healthcare system. You log in and you can get access to your own medical information. You can see your test results from a blood test. You can send a question to a nurse or a doctor. You can schedule appointments. You can ask for refills of your medications, look at your health summary from your most recent visit or your whole medical history, look at billing summary, which is of course relevant in the US where it's insurance and private insurance based. And you can even do things like video visits. So These are all over the place in the US because Obamacare's medical, the Affordable Care Act mandated that hospitals had to have these and had to show that patients were using them. And if they didn't, then they didn't get their Medicare reimbursement. So there was a huge incentive to put these systems out there and make them work. And I have to say, after living in the US for 14 years and using these systems for myself and my children, they are excellent. They are really wonderful at empowering you with managing your own healthcare. Just make it easy. You can log, who was that doctor I saw? Oh, log in. Oh, there's the doctor's name. It's really, really helpful. And now that I've moved back to Canada, I am really seriously missing the patient portal. So I do hope that they come to Canada soon because they are really empowering for patients. And the last thing I want to note is that some portals offer those proxy accounts where somebody else can get access. Most portals actually offer them for pediatrics. So I was able to log in and see my children's doctor's visits and lab tests and all that type of stuff. And that is definitely there in all patient portals, that sort of parent access to a pediatric patient record. And these are going to, they're starting to come to Canada. So this is a link to a CBC article in which at a certain hospital, their cancer care treatment has an online patient portal for people managing that type of chronic illness. Okay, so the patient portal studies that we did, we were looking at patient portal use by low-income older adults in the US, particularly in North Carolina. We did 3 different studies. One was a longitudinal interview study with 200 users. The second was a smaller interview study with 10 users to understand what their attitudes were about granting proxy access to their patient portals. And the third one was a secret shopper study of US hospitals. So I'm going to give you some high-level details on each of these. So here we go. So study 1 was a qualitative interview project. So what we were doing, this is the longitudinal one, we chose 7 healthcare clinics in rural and urban counties in North Carolina, and we did interviews with 200 patients, caregivers, librarians, and healthcare providers. So I think it was about 170 patients, and then a smattering of these other people in these other roles. We interviewed them every 6 months over 2 years to understand, were they using the patient portal, or were they seeing their patients using the patient portal, et cetera. And again, the focus was on low-income older adults, people with chronic medical conditions who really could benefit from the kind of management and empowerment that a patient portal offers. So what we found was there were a lot of barriers to adoption. Some of them were not particularly surprising. Older adults tended to have privacy concerns about what information was there. They also tended to have security concerns, and they often labeled this as there's hackers out there. I don't know what those hackers are going to do, so I don't want my information on these patient portals. What they didn't really understand was their information was there. It was just whether or not they chose to log in and use it. It was there regardless of whether they used it. They were often concerned about losing FaceTime with their doctor if they used the patient portal. They thought it was trying to be a replacement. Some of them just had no interest in using them. And some of them just did not have the technology. They didn't have a computer or a laptop or what have you. They'd have to go down to a local library, for example, to get access. People definitely talked about usability issues. The people who did have technology often struggled with login credentials, remembering passwords, that type of thing. And then there was also a barrier with respect to medical language. So healthcare literacy tended to be a little bit of an issue for some people because there's a lot of technical jargon on these portals. What stood out to me as the HCI, human computer interaction person on the project, was I noticed that almost all patients who were interviewed talked about a caregiver, and a caregiver who helped them with the portal or who used the portal for them. And I found this to be fascinating. My medical colleagues were like, oh yeah, we know that happens, whatever. What about it? No big deal. And I thought, oh my goodness, this seems really interesting from a technological point of view. So they're proxy users, but the portal doesn't necessarily see them as proxy users. And I saw this as an opportunity. Maybe we can help older adults benefit from the portal by promoting proxy use and supporting it better. But there's some issues, and the issues came up. It sounded like from some of the interviews that there was password sharing going on, where the older adult gave their patient portal password to their caregiver or their close other, and the close other then logged in to help them look at test results or whatever. And this comes with a number of issues, which you might be able to guess. So from a privacy perspective, the close other may get access to information on the patient portal that the patient or the older adult really wouldn't actually want to share. So you can imagine things like diagnoses of mental illness or previous history of substance abuse, or even previous reproductive health decisions. And then also medical debt information. So the patient portal is for a hospital. Maybe the patient owes that hospital hundreds of thousands of dollars, and they don't really want everybody to know that they're in that level of debt. Then there's security issues. So if you share your password with somebody, we know that password sharing is a pretty prevalent practice. You use the same password across different systems. And so if an older adult shares their patient portal password with their caregiver, they might have just inadvertently shared their online banking password as well, or password to their email or other eServices. And so the close other could now potentially get access to those other systems, which is problematic. There's also logging issues. If the close other is using the patient's password, there's no way for the people on the other end of the system to be able to see who's messaging them and who's taking what actions in that system. There's potential for insurance fraud because that insurance information is on the portal, and you could use that insurance information to access services that it's somebody else's insurance. And then there's the potential for impersonation, where you could log in as the close other and message the doctor and say, oh, I'm really struggling with my arthritis. I need some more opioids, right? So you can imagine how that could be a fraudulent use of these patient portals through impersonation when the patient shares their password with their close others. So this led to me wanting to do a follow-up study. And so I initiated the second study, which was a smaller interview study where we really delved in and tried to understand, how do patients feel about their caregivers having access to that information on the patient portals? And so this was, we interviewed 10 people, and the participants were a mix of male and female, white and black. We unfortunately did not have any Latino participants here, which is another big group there. And they told us who their caregivers were. Most were immediate or distant family members. In one case, it was a friend. And 7 out of 10 of the participants actually did themselves use their own patient portal. 4 out of 10 of the participants had their caregivers use their portal. So what they told us in terms of access and privacy concerns and sharing, this is a screen that shows sort of a number of different menus in a typical patient portal and the functionality. And the way we conducted the interviews was we'd show a screenshot of each functionality to the user and say, would you be comfortable with your caregiver accessing this, seeing this information, or using this functionality? And what we found was they were happy to have their caregivers or close others look at and help them understand test results. Request prescription refills was fine. Looking at and scheduling upcoming appointments and visits, that was no problem. They thought that was all actually quite helpful. They were concerned about their close others or their caregivers having access to their entire medical history. Request or download the record, and the record is everything on the portal. And they were also concerned about their billing account summaries. They didn't want people to see how much they owed. So, finances are something that people are a little sensitive about. So there was also, you might see here in blue, I've highlighted who's accessed my record. So the patient portal supposedly shows you, who is accessing and using different functionality. But it's not as helpful as you might imagine. So this is a screenshot from who's accessed my record. And, I haven't had anybody, I haven't given my password to my patient portal to anyone, but it shows that I've logged in, and all it shows under the column that says what was accessed? Well, my record, which is basically the patient portal. Not particularly helpful in terms of what functionality was accessed, what information was seen. No idea. Okay. So in general, the findings from this research were that the patients we interviewed saw a lot of benefits in their caregivers having access to their patient portal so that they could help them manage their healthcare. 4 out of 10 of the patients had given caregivers their own patient portal login credentials. So they were sharing their password, their username and password with their caregiver. None of them had set up the proxy accounts, and proxy accounts were available in these healthcare systems where these patients were enrolled. The patients did have concerns about their caregivers seeing stigmatized illness information, but they all said that if it was a case of life and death emergency, they'd be okay with the caregiver seeing that, but they didn't want it to be easily accessible or readily accessible. And in general, I would say that the adult proxy accounts might not be used much. That's what we figured out from this study, is that even if a hospital offers them, maybe they're not going to be used. And maybe it's an advertising issue. Maybe people just don't know they're there. Maybe it's too hard to set up. We're unsure. So that led to some questions that led to the third study. What we wanted to know is what percentage of hospitals that have a patient portal do offer the official proxy account? And if they offer them, do they allow people to limit the information access so that proxies can only see and do certain things? Because that seemed to be a big concern of the people we interviewed. So on a whim, I just sort of did this, without any kind of, not under a real official research umbrella. I called the two healthcare systems in Charlotte, North Carolina, where I was living at the time. And I said, my elderly mother is moving to the city. She needs to get set up with a healthcare system. Do you have patient portals? Can I get an account so I can help her manage her healthcare? And actually, at the time, the two biggest health systems in Charlotte, North Carolina, didn't offer proxy accounts at all. So that was concerning. And I said, well, how can I help my mother manage her healthcare? And they said, oh, just have her share her password with you. And as a computer science person, I was just like, oh, that's not good. That's not good at all. So this led to our third study, and this is the secret shopper study. I love that terminology. So what we did was we sampled 2 hospitals per state, plus the District of Columbia, so 102 hospitals in total that had patient portals. And then we basically did sort of what I had done with the Charlotte hospitals. We phoned the hospital IT department, following a script, the interview pretended that their elderly mother was moving to the area, needed to get registered with a hospital or health system. They wanted to be able to manage healthcare, help their mother manage healthcare from a distance. What are the mechanisms? Can we get proxy access? That type of thing. And so we were trying to find out how many hospitals offer adult proxy accounts. How often do they actually recommend, oh, just have your elderly mother share her password? And if they did have proxy accounts, do the proxy accounts allow sort of a granularity of control so that you could limit what the proxy can see and do? And so what we found was that out of the 102 hospitals, 69 of them, so 68%, offered proxy accounts. So that's not bad. It would be nice if that was higher, but it wasn't too bad. 26 of the hospitals did not offer the accounts. And then personnel at 7 of the hospitals didn't know whether proxy accounts were available at all. So I should say there's a big caveat to this study, which is we called one person and talked to one person. We'd call back until we got somebody to talk to. But this data is prone to some error because it's one person, one hospital staff person's understanding and interpretation of what their hospital offers. And that's the data we collected. So in some cases, they could have been wrong, or they might not know. So then we asked for the hospitals that did have proxy accounts, can the patients limit what the proxy sees or is able to do? And only 19% of them did. So most of the time, if you grant someone a proxy account, they've got access to everything. They can do everything and see everything. And then in terms of password sharing, this was really interesting. So this is a table from the paper where this was published in the Journal of the American Medical Association. So the first thing is whether the personnel said, okay, basically go ahead and share the password. And this was either because the hospital didn't have proxy accounts or because sharing the password was easier than creating a proxy account. So 23 of the 69 hospitals where they did have adult proxy accounts, the personnel still said, it's easier to just have your mother share her password. Of the 25 hospitals where there was no proxy account, 19 there said, have your mother share her password with you. So all in all, 45% of the hospitals that we called, their staff members recommended that the patient share their password with the close other or the caregiver. And then there were another 24% who didn't say no, didn't say yes. They were kind of non-committal about the password sharing practice. And only 31% of the hospitals actually where the personnel actively said, no, you should not share your password. That's bad. We don't recommend that. You shouldn't do that. So this 45% recommending password sharing is a pretty startling number, and it's pretty alarming given the privacy and security concerns around sharing the portal password. So in summary, for all of these studies relating to these US patient portals, I would say that we now know that older adults face various barriers to accessing these patient portals, even though those patient portals can be really helpful and empowering. We know that caregivers can help older adults with their healthcare if they have access and can use the older adults patient portal, and that the older adults actually see benefit in their caregivers using the portal with them or on their behalf. But older adults do have privacy concerns about sort of that kind of access. And the other big finding, I think, is that hospital IT staff clearly need some better training around these issues. So now I would like to pivot over to the Canadian context. So of course, there aren't patient portals generally available in Canada, so I'm not going to be able to easily study that here yet. But I know that eServices in general, that these issues are likely to be prevalent across them. And so I started looking at banking in Canada. And so what I'm curious about is people helping older adults with their banking. How is that happening? Is it secure? That kind of thing. And so what we did was, before we get into this, I'd like to ask you again. So in this time, what I'd like you to do is imagine you end up in a full body cast for a few months. You've had some terrible accident. You have no use of your arms. You can't use a laptop or your computer. So how many people would you trust with your online banking password so they could just sit beside you and go into your bank and help pay your bills? So type the number of people that you would trust into the thing. So I'm seeing 3, 2, 1, 2, 4, 2, just one person, 1, 0.5. Okay, so these numbers are generally pretty low. Actually, I'm a little surprised that there's that many people who say there's about 4 or more people. But people generally tend to be pretty careful about sharing their access to their finances. So people are private about it. They don't want people to know how much money they have or how much they make. And people are worried about other people having access to their bank account and stealing money, of course. So in general, we think that the number of people you're willing to trust with this is pretty small. But in some cases, what if you don't have a choice, right? And so that's where we're looking at with older adults. If you don't have somebody who you really trust, you might end up sharing your password with somebody who you don't necessarily really trust. So what we did was we surveyed participants, we surveyed people who help older adults. So we weren't surveying the older adults themselves, we were surveying people who said that they helped older adults with banking. We asked them about the age range and independence level of the older adult that they helped. We asked what type of finance or banking tasks they helped that older adult with. We asked about banking modalities. So were they banking in person, by phone, are they using mobile banking, online banking, etc.? And we asked whether or not the person helping the older adult has financial power of attorney for that older adult, which is a legal document that gives you legal access to help that older adult and access to their accounts. And then we asked if they were doing online banking with or on behalf of the older adult, how they were getting access to the older adult's online bank accounts. So the close others, the participants in our sample, basically said that they're helping older adults with a pretty wide variety of banking tasks, lots of bill paying, transferring money, monitoring balances, that type of thing. We found that the people that we surveyed are more likely to do banking on behalf of the older adult. So they're doing banking for the older adult. They're not sitting with the older adult or going with the older adult to help them. They're doing it for them. Predominantly, the modality was online banking. So most of the people that we talked to were doing online banking for the older adult they help. And often they know the online banking credentials of the older adult. So they know the older adult's banking password and username, 61% of the participants. Now, that sounds a little bit alarming, but often the people that we surveyed are designated as the financial power of attorney. So the older adult and this person have gone to a lawyer and said, yes, we want this person to be able to do financial transactions on behalf of the older adult. But it wasn't a perfect overlap. There are people in our survey sample who knew the online banking credentials of the people they were helping, and they were not designated as power of attorney. So there definitely is some password sharing going on that clearly is outside of the terms of service of the banks. It violates their terms of service because that person is not a power of attorney. And in fact, even when there is a power of attorney at play, it is not clear that sharing your password with the person who has power of attorney is within the terms of service of the banks. I think it usually isn't, and banks don't want the power of attorney person using the online system typically to do banking for that person. So there's a lot of issues here. There's a lot of gray area. And so I'd like to share this quote with you. So this is from one of our participants. And he said, I have power of attorney for my mother. I live in this one city, and she lives in another city that's far away. She still has the ability to do her own banking, but needs occasional assistance. So this is important. There's a tendency to think somebody can do their own banking or they can't, and it's black and white, but there's a lot of gray in the middle where somebody just needs occasional help. He goes on to say, the bank will not give me my own ATM card or online banking credentials. So this is for his mother's account. I'm only allowed to do that when she's declared incompetent, and then I take over and she gets no access at all. So again, this is a bank that's saying, the power of attorney doesn't actually come into effect until she's declared incompetent. Until then, you can't really do much with her stuff. And once that's happened, she can't access her bank account and only you can. So it's a very, very sort of binary type of approach to who has access to the accounts. And it's not clear that all banks sort of take this very harsh binary, but in this case, it's happening. He says, I can only assist her by going into my local branch and have them do all the things that I would normally do online banking. So he has to go to the bank when they're open, only during business hours. He can't do it online. He says, it has been very inconvenient and very frustrating. When she's declared incompetent, I'm not sure how I will get her cash when she needs it, since she will no longer have ATM card access. So there's a lot of issues being illustrated here about this sort of the bank's policies and the access to the banking technology that doesn't really fit the needs of these users, and this sort of gray area and occasional assistance that's clearly needed in some cases. So a lot of issues around power of attorney and policy. So clearly technology isn't going to be the full-on answer here. This is going to have to be a combination of policy change and technology enabling more sort of gray area access. So there's inconsistencies in how banks treat power of attorney documents. We've seen a lot of instances where the bank asks for the power of attorney, they take a copy of it, they send it to head office, they don't keep it in the branch, you go back, they say, what power of attorney? And you have to bring it with you every time and go through and show it and have it verified every time you want to help the older adult. Banks are obviously worried about liability issues. Password sharing that happens violates banks' terms of service. So that's problematic for the bank. And yet we know that this is happening. Most banks don't offer proxy accounts, even when a power of attorney is in place. Instead, they tend to put the power of attorney person on the account as a joint account holder. But there's problems with joint accounts. So when you have a joint account, that means that your debts and liabilities are also joined, and that may not be a good thing in certain cases. Some people can't get a joint account, and maybe it just doesn't make sense. If the person helping you with your banking is a distant cousin, do you really want them to be a joint account holder? So these are the types of issues that arise here. And at this point, we know of no banks or credit unions in Canada that offer proxy bank accounts at all that are outside the power of attorney framework. So nothing for that person who doesn't want you to be power of attorney, but occasionally wants a little bit of assistance. I don't know how to set up this new bill payee, for example, right? So there's definitely some areas for improvement here. All right. So what I want to do now is turn to share some of the thinking that I've been doing about design considerations and ideas to support proxy use, because I think this is a blind spot for these e-services. This is an opportunity. They could be helping their customers more by explicitly supporting proxy use by caregivers or close others. But how could that work? So before I sort of share some of these ideas, I want to again remind you that the proxy relationship is complex. It's not always one person. It's not always an immediate and highly trusted family member, could be friend, neighbor, distant relative. And so we need to keep in mind the complexity and the changing temporality of these relationships. And I also would like to point out that these design considerations don't just apply to older adults. Of course, that's my area of concern, but other people sometimes need proxies. Obviously, children need proxies, and people with a disability or people who are just temporarily sidelined by some kind of illness may need proxy help. So this applies more broadly than just to older adult account holders. So one of the things that we've been thinking about is expiry dates. So if you set up somebody to have proxy access to your account, well, that relationship could change. Over time, maybe you don't need help any longer. Maybe it was temporary. So having expiry dates by default every year, you need to renew. Do you still want this person to have access to your account and be able to act on your behalf? Right. So having this could be sort of a safety check for the older adult or the account holder. Logging is really critical. So if you're setting up a proxy account, when the proxy logs into the system on behalf of the account holder and performs some action, accesses some information, that should be clearly logged. It should be easily visible when the account holder logs in, or if the account holder themselves is not really actively using the system, it should be sent to them, maybe by email or maybe by physical mail every month, so that they can see how the proxy is using that access and what they're doing. We also think that there should probably be limits. Some functionality just should not be available to somebody who's logging in as a proxy rather than as the account holder themselves. So for example, if we were sending logs of proxy actions by mail to the account holder, then the proxy probably should not be allowed to change the mailing address, so that they could then make sure that the older adult wasn't getting that, and then they could engage in fraudulent action. And then also blocking. So we think that older adults, if they suddenly get suspicious that the person who they've given proxy access to is doing something malevolent or fraudulent, they should be able to, with just a simple phone call, sort of immediately block access to that account by that proxy. And then checks and balances. And I think this is particularly relevant in the financial services area. So when you've got critical assets at play, if you're going to allow one proxy, it may be a better idea to require two, so that then there's somebody keeping an eye on the person who's acting on behalf of the older adult. And so you can imagine that if this could actually just prevent sort of probably what is a myriad of very minor elder fraud instances that are happening. So I'm helping Aunt Jane with her banking, and I have to go in a couple of times a month and pay bills and do all this stuff and get her cash from the ATM. Well, I'm going to actually take out a little extra $100 for me because I'm doing a lot of work for her, right? It would be much less likely that you would do that if every action that you took was logged and the other proxy got a notification of what action was taken. You'd be much more careful. Now, this is not going to prevent elder fraud in the case where the two people who both have proxies are in cahoots and really want to, take all the money away from the older adult. So it's not perfect, but it would likely cut down on some of the minor elder fraud that's happening at least. So those are ideas if you're going to design an eService with proxy accounts. But one of the things that I think is really interesting to consider is we know that people are going to share passwords. We've seen it in the studies that we've run. And we know that in some ways that's just simpler. It's just easier. Oh, here's my password. Log in and do this thing for me, right? So one thing to think about is if password sharing is pervasive, should the eService acknowledge that, design sort of safety checks into the system to actually try to mitigate the risk to the older adult when they do share their password. So what could this look like? Well, the first thing could be that when you log in, the system asks, are you Jane Doe or are you someone acting on Jane Doe's behalf? And, if you're somebody who in good faith is helping your neighbor or, your aunt or whatever, you're going to say, I'm Jane's helper. You're not going to say, I'm Jane. You're not going to pretend to be her if the system asks you. So this clearly is not going to protect against the people who really, really want to engage in strong fraudulent activity, but this is going to help in a lot of ways to cut down on sort of minor issues. And then, the system could ask the helper to enter their name. Now, this is a controversial suggestion, and the reason is that this basically explicitly acknowledges that password sharing is happening. And in that sense, it can be seen to be condoning password sharing. And so you can see that from a bank's perspective, this would be probably pretty controversial and considered probably highly problematic. And yet, it may be a much more pragmatic way to approach some of these issues. Then if you know that if a person has said, no, I'm the helper, then you can log things. And this can then be visible. So we can see that Jane Doe did this, but her helper did these other things. And this could also be visible to Jane. So this is sent by mail or email to Jane, and she can see what she's done and what somebody acting on her behalf has done in the account or the eService. There could also be a way to sort of put up blockages or warnings around certain content or functionality within the eService. So again, thinking back to the patient portal example, if somebody's in there, they're renewing prescriptions for Aunt Jane, and they can see like there's a link to diagnoses. They just randomly click on it because they're kind of curious. If this type of warning came up, you're about to view sensitive information about a mental health diagnosis. This action will be logged, and Jane Doe will be informed of this viewing. That is suddenly a little bit of a barrier to saying, well, wait a second. If I look at this, I'm going to find out something about my Aunt Jane's mental health. Maybe I want to know, maybe I don't. And she's going to know that I found that out. Okay, maybe I'm going to step back from this. I'm not really supposed to be doing this. I'm just supposed to be renewing her medications, and you cancel out, right? So this gives people a chance to back up before they get somewhere in a system that maybe they really shouldn't be going. You could also ask for extra security. So you could ask people to verify their identity, uploading a picture of their government issued ID, and actually not let them go any further in the system until that's verified. So there's possibilities on that type of level as well. And then maybe this has to be verified with the older adult. And this type of sort of acknowledging that someone is password sharing and they're using the other person's password to access the account, you could take this as a pathway to push them towards, well, we see you're helping. Why don't we make it official and give you your own login credentials? And that way, then you can start doing the logging that's a little bit more comprehensive. And of course, this, so you say yes to this, and then it would have to be verified with the older adult through some other mechanism to make sure that the older adult actually does really want to make this sort of an official helper in the system. But it's a nice way to sort of maneuver people who are occasional helpers into sort of a more formal and safe version of that helping. And finally, you could think about something like providing one-time access codes. So, Aunt Jane needs my help. She has a new bill to pay. It's a new payee. She doesn't know how to set that up. She's not very comfortable with the banking technology. Celine, can you log in and help me with this? Well, what if she could grant me a one-time access code? Then I can log in once and set that up, and it wouldn't let me log in again. She doesn't need to share her username and password with me. And when I get in, I see warnings like this. It says, you've been granted one-time access. All actions taken will be logged and sent to the account holder, etc. So this is another possibility for the kind of supporting the occasional help that people sometimes need with these e-services without going so far as to create an entire official proxy account. All right, so to sort of summarize what I've talked to you about today, we know that close others are using e-services to help older adults in their lives. It appears that in most cases, e-services are kind of turning a blind eye to this. They're kind of ignoring it's happening. Most e-services do not offer proxy accounts. And this is putting older adult security and privacy at risk because when they need help, they are then sharing their password with the close other. And that leads to a host of potential problems. And so we need to sort of start thinking about how do we design eService proxy accounts with usability and security and privacy in mind. And should we be designing eService systems pragmatically, knowing that password sharing is happening and is going to happen? Should we actually in some ways explicitly acknowledge this and work to mitigate the risks and work to maneuver people into a more official and safe helping mechanism? So, and overall, in general, I'm kind of interested in, can we look at proxy accounts as an opportunity instead of as an eService thinking, oh, this is such a problem, it's so complex, I don't want to deal with this, I'm just going to turn a blind eye to this password sharing. Why not think opposite and think about it as an opportunity? How can we actually support our users by better supporting their close others or caregivers? And what opportunities does that provide for new services, new products? And so that's a different way of sort of thinking about this. Instead of thinking about it as a problem, let's think about it as an opportunity. So with that, I will thank my colleagues at the University of Manitoba from various departments who've helped, and my Wake Forest Medical School colleagues, of course, who I worked with for many years. And I will take questions. I'm available to be reached at all of these different addresses and locations. And I would also like to say that I am searching for PhD students. So if you're interested in this topic, please feel free to come and work with me. And thank you for your attention. And I'm happy to take your questions and comments.
Thank you for this talk.